Everyone. Thank you for joining us today on our care induction. Um, Today, we're going to make you have full details how our health and social care provide support in the community hospital, mostly in mental health organization. For those who have registered and paid their fee, and you happen to join us now, thank you very much. And this is your opportunity to have a good understanding, knowledge in the role of providing health and social care support, working in health and social care organization, and able to support, give support to your clients. This included the knowledge of news, observation, understanding the importance of data protection, and the Mental Health Act 1983. This act was updated in 2007. So it's also very important that you know your role in working with different multidisciplinary teams. This is what today is all about. So if you want to work in the UK, you want to work as a support care worker, you want to work as a healthcare assistant, and you want to work with a bank, either with the NHS or your local NHS, your national NHS, this program is for you. Not only are you going to complete this award in working in health and social care level 3 by OFC Training College, you will also have the chance to gain into our recruitment consultant platform, where you can get the role to work as a healthcare support worker. If you're an international community, very important you contact us through info@ofctrainingcollege.co.uk. At the same time, we can let you have access to this application for free. Yes, you have access to this application for free, but this training we offer is not for free. You must make sure you pay for the training, the courses you take from OFC Training College. Also, make sure you register. Registration is very important. When you register with us, this helps us to identify who you are. When we have any new updates of programs, we let you know. When we have maybe requesting reference, recommendation in the community, we will be able to support you. That is what this training is about. So if you receive any of our video, you are watching any of our video, make sure you always understand the message when we talk about the role of a support care worker. This also helps you during your interview if you want to work in the UK, because your interview, you should be able to understand what we call 6Cs. So 6Cs now give you basic values, knowledge, healthcare roles and responsibility in providing when we talk about evidence-based care, evidence-based support for individual, either with mental health or those who suffer from dementia, or those who are diagnosed any kind of illnesses in the hospital, care home, community, or rehabilitation center, in any of the trusts or local or private healthcare organization. So now, at the end of today, as I said before, you should be able to have that evidence-based clinical practice knowledge, skills, to provide qualitative care for people who are unwell. So first, let's talk about what is health and social care organization. How will you identify health and social care organizations? And who are those working there? And what is your responsibility as a support worker or support care worker, healthcare assistant? So now, we look at the GP. We also look at pharmacy. We look at nursing home, care home, hospitals. We also need to look at community care. So these are the areas when we look at health and social care organization, where you are most likely to work, depending on your skills, knowledge, or education. Education in the sense of your experience, majority of the time, we always talk about education is not too relevant. But the fact that you cannot be working, you don't learn. You cannot be at work where you don't learn. I don't know if I'm right. You cannot be at work and you are not learning. It's always very important that whatever we do, even if you are a voluntary organization, you're working with charity organization, let's look at the past COVID-19 crisis. A lot of people engage in the community activity. Yes. Is he providing compassionate care? Is he reminding people of their medication? Is he helping people to call for their appointment? Is he telling people the information, the update on how to wash their hand, providing basic infection and control activity? So these are experiences that you must have had in your community that you need to bring on board when it comes to working as a support care worker or healthcare assistant in the UK. So again, what is your role? What is your role? Now we have understanding of health and social care organizations. What are your role in this healthcare support work as a support worker, either band 2 or band 3, or healthcare assistant? So your basic role is to provide compassionate care and evidence-based support for those who are vulnerable, those who need you most, who are aware. They might be hospital, care home, nursing home. So now, some of the activity that you'll be doing can be personal care, maybe giving someone a bath, or helping someone wake up in the morning, taking someone from their room to the lounge, or dressing someone up using equipment. When we talk about having to gain skills in moving and handling, where you can move someone from bed with a wheelchair, hoist, wheelchair, or maybe Zimmer frame, whichever mobility the person is using. When we talk about mobility aids that people use to support themselves to be able to be independent, or you might require to use the wheelchair to push them around in their garden, maybe from the lounge to the reception area or to car. So there are other aspects of care that we might be looking at when it comes to working in mental health setting. So when we talk about communication skills, compassionate and helping people understand the importance of good emotion. So these are all your role when it comes to healthcare support worker. Again, the most important part is documentation. Documentation only comes in when we talk about MDT. So now, what is MDT in health and social care? MDT means multidisciplinary team. Multidisciplinary team. So now, you as a support worker, healthcare assistant, your role is to partner with your patients and the MDT team. Who are the MDT team? This includes you, patient, doctor, nurses, manager, and other of your colleagues who are on the same level, band 2 or band 3. This involves the GP in the community. So you all are working together, either through the patient care plan that has been written down. So care plan involves the care, the activity, the needs, the wants, like do's and don'ts of an individual, so that you will be able to provide the best care as possible for this individual. Yes, it doesn't matter whatever illness or treatment or diagnose this individual is having or need to have from you. But when we talk about life expectancy, you as a support worker, healthcare assistant, band 2 or band 3, also know that your role is also very important to make sure this person have the best possible life they could have, either in their own home, in hospital, in care home, mostly those who are under Mental Health Act 1983, which was updated in 2007. So what does this act mean when we look at Mental Health Act? What is your concern? What is your role as a support worker in supporting people who is diagnosed having to have mental health problem or issue. Now, the first thing you need to think about is when we talk about compassionate care. This regulation was put in place in order for us to have evidence-based requirement to provide compassionate method of care through therapeutic and emotional responsibility to make sure this person can also be able to engage in their day-to-day activity. Yes, if someone is mentally aware, the person might not have capacity, might not have understanding. The person might not understand their environment anymore. They might not even remember who they are. So your responsibility is to make sure this person have access to assessment, diagnosis, treatment at the same time. That is what the act is about. It's for you to be able to have this, not just power, because I wouldn't like to use the word power. It's for you to have a responsibility to know that everyone counts when it comes to providing the best possible care. Yes, let's look at what WHO said, that every individual, every persons in community, country, cities have every right to healthcare service, information, and support they could require in their community. This is where you comes in to support individual who is diagnosed with mental health issue. So now, let's go back to clinical practice. A lot of people might be asking, what does clinical practice means? What is clinical practice? So now, clinical practice is part of your role when it comes to work in the hospital, nursing home, community, or care home. Clinical practice can involve documentation. It can involve you focusing on the needs of your patient through their care plan. What is this person diagnosed? Let's talk about depression now. Someone who is having depression. So some of your clinical practice can involve you having to have therapeutic skills, therapeutic observation, therapeutic sub-communication, therapeutic engagement with this person to be able to understand that they are not alone. That's the first thing. Also to understand that there are hope for them and there are services that they could able to gain access to in the community. So this involves you knowing when they had to sleep, knowing when they had to have medication, knowing when their medication due and what the medication side effect is about. So now, you don't have to have deep down knowledge of this. So that is where we go back to MDT. Your role as a support worker, the best way you provide clinical practice is to work with registered nurses, registered doctors, registered clinicians in your healthcare by having good communication with them about your individual patient. If you don't know anything, just ask the doctor, say you are a support care worker. What is your advice to be able to provide care for this person, for Mr. A or Mr. B? That's not difficult to ask, isn't it? And I'm 100% sure I've worked with lots of clinicians and they always respond to that question. One of the answers a clinician gave me in PICU, Psychiatric Intensive Care Unit, he said, Alex, he said, the best way to provide healthcare assistance support for any of these patients on the ward, so forget how many numbers they have. He said the first thing you need to think is think psychosocial. He said, think psychosocial. So now you can see you having knowledge of what psychosocial is about. That can actually hit the road for you to be able to provide evidence-based care for every individual. This involves able to understand documentation, the illness this person is having, and when you are doing the care plan, you're writing a report. Does this person involved in every social activity? Was this person having psychotic issue during the shift? Was this person mentally stable during the shift? Did this person have food to eat? Does this person able to communicate? Does this person able to see properly? Does this person have orientation during your shift? Does this person able to sit down? What's their mobility? Were they able to use their walking aid or mobility aid during your shift? What are the activities that you engage with this individual? So now, you have massive role to play when it comes to your relationship with your clients, patient, or resident. So support worker role is one of the best role I could ever think of when it comes to having compassionate support to individual. First, to be the best care worker, to be the best healthcare assistant, you must be someone who is caring. You must be someone who is caring. A caring person finds it easier to provide evidence-based care and support for their client than someone who just want to go into care because of the money. Yes, I'm waiting for my pay now. Oh, I'm on shift now. Let the shift finish so that I get paid. Or I just want to travel from Dubai to UK to come and work as a support care worker just because of the money. I tell you what, you are in the wrong job. You have come into the wrong job. Because when we look at the care and support, the training we provide, we aim to provide evidence-based care, to provide quality health care. That's what OFC College is about. That's what OFC College is about. So if you have attended our training and at the end of the day you have that mindset, I think you are in the wrong job. Because people who you are providing care for, majority of them have taken lots of responsibility in the community, that they deserve respect, they deserve values, they deserve that kind of support, whereby not just you getting the money to go and support yourself, but you must make sure you work for that money in the first place. That is just my own advice. You know, that is just my own advice because you also have family member in the first place. You won't expect to have dad or granddad that is unwell and someone treat that person unusual, the way you don't like. You know, again, when we talk about clinical practice, it's also about promoting safeguarding, providing privacy, providing that individual and letting that person have the respect and values that they require in that care home, nursing home, or mental health organization. It does not matter if the person is sectioned under mental health act. They still have their human rights. Of course, they still have their human rights. Your responsibility is to work according to that assessment, treatment, and support them to make sure they are safe. Yes, now, we're talking about health and safety. In their room, if someone who is depressed want to commit suicide, make sure their room is safe. There's no wire, and they put you on eyesight. Make sure you are there. If you are tired, make sure you let whoever is in charge aware that, oh, I'm tired now. You know, if they can't communicate in some shift where you have staff are very busy, they are short of staff, make sure you have other person with you doing eyesight so that when you are tired, the person can, hey, you are tired and support you rather than you being alone looking after someone who is vulnerable and you are tired, you are not reporting to anybody. That is not good. It's not a good practice. Okay? It's not a good practice. So now, being professional is about coming together to understand your role as a healthcare assistant, understand the importance of news observation, and make sure you document it after taking patient news. News observation where you had to do use blood pressure machine, oximeter, thermometer. In some cases, you might use your watch to check the person's respiration side. Make sure the person is talking, is alert. At the same time, when you are doing eyesight observation, also make sure the person you are looking after is alert at all times. Breathing, check the breathing, you know, and check the respiration between 60 seconds. between 12 to 20 or 21 is great. But if it's lesser than 12 or more than 20, make sure you inform the clinician or the nurse in charge. So these are part of your clinical practice and being professional. Time management, make sure you get to your work on time so that they will be able to give you handover to talk to you about the patient whoever is on duty. You might know their care plan, but now there might be changes because you've not been on shift for 2 or 3 days. So you need to get to work on time so that you'll be able to catch up with basic awareness of any changes that are there before you start your shift. And again, go back and check the care plan. If it's not updated, make sure you update the care plan so that you can provide the care as easy as possible. Lastly, let's talk about your mandatory training. So now, being a support worker, when we talk about professionalism, it's your priority to make sure you complete your mandatory training in healthcare job that you are doing. Your mandatory training, some organizations can offer you mandatory training for 12, maybe 20 different courses that you have to do. So it's your responsibility to make sure they are up to date. It's your responsibility to make sure they are up to date. Mostly the mental health awareness, understanding Section 17, where you had to escort the patient out of the building and bring them back, understanding how to check if they are having Section 17, understanding their safeguarding, understanding Mental Health Act, understanding infection control, also understanding data protection, knowing who to speak to. You know, some patients like their privacy. They don't want anybody to know they're in hospital. So it's your responsibility to make sure you are up to date in informing every of your colleague or whoever is in reception, or if it's you picking up the call, make sure that patient privacy is very important. Apart from that, many of us work in care home, nursing home community. And these days, we have what we call mobile phone. When you are at work, it's your responsibility to make sure you are not making call while at work. You are not doing any recording while you are at work. And you kept your patient profile absolutely private, including your profile, making sure patient is not having access to you on social media. You are not interacting with any patient on social media. You are not having a relationship with a patient on social media. Just as you will respect your patient, you need to also respect your colleagues. Yes, this is very important when we talk about being professional. So make sure you have 3 basic education. Mental health awareness, so that you will understand Mental Health Act 1983. Also, safeguarding, data protection, and infection and control. Again, among your mandatory training, if you're going to work in mental health service, you need to have what we call MAPA or PMVA. These are therapeutic engagement when we're talking about physically supporting patients to make sure they are safe and they are supported and give the best possible care. So without this training, no matter how aggressive your patient are, no matter how violent your patient are, do not touch them. Do not restrain them. Even if you have the training, make sure you provide, when we talk about least restrictive practices when you are at work, using the last resort to make every possible decision in your shift. So now, for more training, today, let's look at what we have looked at. We have looked at news observation. We have looked at Mental Health Act. We have talked about Section 17. We've talked about data protection when we talk about mandatory training. We've also talked about working in health and social care. What are care organizations? We talk about nursing home. We talk about GP. We talk about pharmacy. There are many roles in health and social care when we talk about physiotherapy, doctors, nurses, healthcare assistant support worker. We talk about band 2, band 3, band 4, band 5, band 6, band 7. We also have the clinical manager in your shift. So now there are many roles when it comes to working in health and social care. And also, we also have you being professional when you are at work. So now, make sure you keep a diary. This program is recorded, and you can keep watching it and watching it again. At the same time, make sure you complete your assessment and a request for your certificate on completion of both the e-learning and the induction part in the health and social care. So the final part of your induction is to understand the health and safety rules. So we're going to talk about interview in our next program. We'll talk about interview. We'll talk about your induction of completing your mandatory training, different kinds of mandatory training. We'll also talk about your induction of knowing the staff you are working with, the environment at your workplace, knowing who to contact when you are at work, who is your lead role, who do you need to report to, and how to report safeguarding incident while you are at work. So now, safeguarding incident is also very important. When we talk about safeguarding, we're talking about your relationship to promote safety at work. If anything is wrong with patient, report it. Anything that you feel it doesn't right, report it. And safeguarding lead in your organization, we have safeguarding report system in place when it comes to your workplace policy and procedure, which link to local council. Every safeguarding chair in your community is your local government council. So there should be safeguarding lead in your organization. You need to make sure you understand who they are and how to provide, how to engage in best possible training that you require to do that particular job in the ward you are working for, because we have different kinds of jobs. We have different kinds of patients. We have patients in the rehab. We have patients in the dementia unit. We have people who work in camp, children mental health community. We also have those who work in the actual community that provide face-to-face care, home care, and we also have those who do living care. So you're going to be having different kinds of mandatory training. We also have people who are working in prison. We also have people who are working in forensic unit. Those are very important roles that you need to understand your mandatory training and update them. So thank you very much for attending this program, for watching this program, and also for listening to OFC Induction Training and Basic Award in Working in Health and Social Care Level 3. So now, we have event coming up. We have event coming up in 2024. So this event is UK Professional Healthcare Training Seminar. UK Professional Healthcare Training Seminar. You attending this program will give you more support in providing evidence-based care. At the same time, you will have the opportunity to register to get a support for application form in any job you want to do in healthcare. Also have the chances to register as a global recruitment or individual or self-employed trainer in the community that you will be qualified in this program once you attend. So it helps you to engage in what we talk about basic evidence-based care as a support worker. It doesn't matter your profession anyway, but the fact that the moment you attend this program, you will have access to many qualifications that could be able to make you be self-employed in the community. Yes, that's what this event is about. So if you are international and you get your ticket online, make sure you send the ticket to info@ofctrainingcollege.co.uk. So when you send your ticket to info@ofctrainingcollege.co.uk, we will send you an invitation letter for this very event, for this particular event. And make sure you get up to date. Any changes, we will also let you know. If we have access to your email, your phone number, we will contact you to know any changes that is taking place. So now, OFC College provide accreditation. We are a registered and accredited organization. We provide support for people who want to provide training. We also provide mandatory courses, CPD, continuing professional development. For those who are asking, my name is Alex Oni-Edigin. I'm one of your global continuous professional development lead and also your clinical practice manager under OFC College and OSA First Care Recruitment Organization in the UK. So thank you very much for joining and for watching. We will always expect you to ask any question. And if you didn't enjoy the program or you enjoyed it, let us know. At the same time, join us in every Saturday live program like this so that you can gain more knowledge in working in health and social care in the UK.